My name is Ellie Mais, and our project is SPG blocks for post-dural puncture headaches. Many laboring mothers choose to have an epidural for labor pain when they have a baby. An epidural is performed entirely by feel, with the goal being to inject local anesthetic into the epidural space. The epidural space is about the size of the inside of a Cheerio. The most common adverse effect of an epidural is a post-dural puncture headache, which occurs roughly 25% of the time. If the needle is advanced slightly too much, it can puncture the dura and lead to spinal fluid leak. When spinal fluid leaks, it causes a downward traction of the brain, leading to an intense headache that can last up to a week. The classic presentation of post-dural puncture headache is severe pain in the front of your head, which may or not be accompanied by nausea, vomiting, and sensitivity to light. The headache usually gets better when laying down and worse when sitting up. For years, the treatment has been an epidural blood patch, in which we perform the exact same epidural procedure over again. Once the epidural space is located, we inject the patient's blood into her epidural space. As you can imagine, this is often difficult, risky, and can be quite uncomfortable for the mother. We focused our research on a new, much less invasive procedure called a sphenopalatine ganglion block. The sphenopalatine ganglion is a parasympathetic ganglion located in the back of the nasal passage. The SPG junction has sympathetic, parasympathetic, and sensory innervation overlapping in a very small area. The SPG block has been used for a long time for treating headaches of varying etiologies, but is especially useful for the patient with post-dural puncture headache. Our goal is to educate anesthesia providers on how to perform this easy alternative to an epidural blood patch. The first step is to soak a long cotton-tipped applicator in local anesthetic solution. Instruct the patient to lie down flat and extend their nose to the ceiling. We then insert one applicator into each nair towards the middle turbinate. Continue inserting until you encounter the posterior wall of the nasal passage. This is in the vicinity of the sphenopalatine ganglion. Inject 2 to 3 drops of local anesthetic in each nair. Leave the applicator in place for 10 to 20 minutes. The patient should immediately feel relief. This is an easy, non-invasive procedure to try prior to attempting an epidural blood patch. In one study, headache pain relief with SPG block was 64% versus 31% with an epidural blood patch. I have personally performed 7 blocks with a 100% success rate and continued pain relief for 24 hours post-procedure. Thank you.
Boom. 12 seconds.
Perfect.